When I got the BRCA2 gene mutation diagnosis, I knew from meeting with genetic counselors that I had an increased risk of ovarian cancer, and so that the recommended first course of action was to get my ovaries taken out. I was not thinking about getting my breasts removed and reconstructed at that time because I was so used to getting mammograms and MRIs and, exams. So I felt like I was being well cared for, so if cancer was going to pop up, we were going to get it really fast and nip it in the bud and it wouldn't be a big deal.
She is, young, she's married, she has 2 young kids, and then all of a sudden her world is torn apart by having a diagnosis of BRCA1 or BRCA2. And you can just imagine how much of an issue that may be for a patient. And if it's any testament to Heidi's story, we had spent a good 2 years talking about what the various options are.
I was lucky to have a friend who is a genetic counselor, and so we were able to have a really candid conversation. I remember her looking me in the eye, saying, do you realize you could die? And that was kind of a moment for me. And then she said, why would you not want new boobs? And I have 2 kids and I have breastfed them, and so they're not as perky as they used to be. So that was really when I started thinking about doing reconstruction.
One of the things I think is important in a breast cancer reconstruction journey is my goals are not to simply put you back together or put the patients back to a reasonably looking breast. I want the patients to look better than they ever did. Traditionally, in tissue expansion and breast reconstruction, we've had some limitations. A tissue expander is not like a regular breast. It's a balloon that fills up with saline that expands in 360 degrees. But if you look at a breast doesn't look like that. A breast has a drop to it, it has a fold to it. The top of the breast is a little slanted compared to the bottom of the breast, and it has a definitive shape that looks like a teardrop. Well, that was some tremendous feedback that the engineers at Mentor took to heart. One of the most remarkable things I've experienced about the company is the integration of their engineers and their specific design to clinical medicine. I've never been involved with a company or seen a company where the engineers are so intimately involved with what's happening at the end of the operating room.
I kind of learned about what a worst case scenario would be, and I was prepared to go in to do that particular surgery, and then I found out this expander existed. And I trust Dr. Pacella, so here we go. I would say it's important that you have a good primary doctor who can help you build a team if you have cancer or if you don't have cancer, because you need a general surgeon, you need a plastic surgeon. I needed my primary doctor to help me when I needed to go on blood pressure medication. I needed an OB/GYN oncologist for this. I didn't know all the people that I needed on my team, and then once I knew the players that I needed, I didn't know who to go to, and I had a great relationship with my primary doctor and really trusted her recommendations.
One of the things that I think was really exceptional about the process with Heidi, which mirrors what we do with all of our patients, is the dialogue between myself and the oncologic surgeon, the breast surgeon. So we really approach this not as one size fits all, but Dr. Scorbagati had the opportunity to meet Heidi ahead of time, as I did. He and I spent a lot of time discussing about the true optimal plan for breast reconstruction, and it's really paid dividends for Heidi in the long term. And now she can live the rest of her life without the fear of one day feeling a lump on her breast and being diagnosed with breast cancer. The first thing to talk about with Mentor's involvement in this project is just providing an exceptional product. There's really nothing on the market that does what the Artura expander does. No other device really can optimize the expansion of the lower pole. And Mentor just having a catalog of amazing products really makes my job a lot easier. The second tier to this is just the involvement of Mentor within this project. One of the things I love about the company is the ability to sort of think outside the box and how we can not only create a good and beautiful breast reconstruction for patients, but how we can reach other patients. We first met Heidi about a year ago as she was going through her breast reconstruction. She is, of course, BRCA or BRCA positive, fairly high risk for developing breast cancer. She had the luxury of a lot of time to make this decision. And I think that's really prepared her for what she went through throughout the process. She's exceptionally happy with her breast reconstruction. She's really pleased that we have a very beautiful, natural shape to the breast. It doesn't look like there's just simply an implant underneath the skin. I think we've really hit a home run with that.
It's been behind me already for months. Now that it's over, a lot of my friends have said, oh, I can't, I have to go get a mammogram or blah, blah, blah. And then I think, oh, yeah, it's cool, I don't have to do that anymore. Like it's kind of like when I moved out here from Buffalo. It's the absence of weather out here in San Diego. It's like I don't think about the risk anymore. So that's cool.
Heidi's story will be resonated for many women that have been diagnosed with BRCA positivity and many women diagnosed with breast cancer.